Are we ready to go?
Yes, ma'am, we are good to go.
Excellent. Thank you so much. So, good evening, everyone, and warm greetings from the Indian Pharmaceutical Association Community Pharmacy Division to all of you. It is extremely nice to be a part of a very enriching group of people, very committed to what we are doing at the moment. Because, as you're all aware, we have started uh, we have had 3 consecutive programs, and it is nice to be meeting again on the World Health Day today. So, as it goes, since the year 1950, the World Health Day has been observed, and it is observed on the day the WHO was created. And the whole idea of having this day is to look at global health and prioritizing global health. Now, during the times of COVID, there can't be a better time to be looking at global health and how do we start working synergistically towards it. So, this year's theme, as decided by the World Health Organization, is building a fairer, healthier world. So, the reason why we're looking at a fairer world is mainly because there is so much of inequality between countries and within countries. And if we have to address this inequality, then it brings us to the next level of, as healthcare professionals and as community members, how do we need to start working together for a common cause? And I think COVID has started showing or shining the light on all the fault lines that are existing in the healthcare systems around the world. And learning from those fault lines is the biggest lesson to be moving forward, because it will not only help us address the current pandemic challenges, but overall, it will help us address how do we need to improve our own health system. So, strengthening our healthcare system. And a part of that is also about all the roles that we play in advocacy, in education, in leadership, etc., that needs to be happening in this area. And what is also very nice here is the collaborations that are coming through for the IPA CPD team to be functioning effectively. So it is really wonderful to welcome Dr. Rajesh Arora, who is the Vice Chancellor of Apex Professional University. And as a part of this collaboration that we have been having with his university, it is nice to welcome him. And the other organization that we are collaborating with is the Pharmacon Society for Pharmacy Practice. Now, this is led by a very dynamic leader, and it's really nice to have excellent leadership starting to percolate into our own systems. And what it brings in is a good space where IPA CPD with APU and with Pharmacon Society for Pharmacy Practice are working together for the common goal of looking at how do we build a fairer, healthier world for everyone. So, with these few words to initiate the program, I would like Dr. Rajesh to please address us. Over to you, Dr. Rajesh.
Good evening, everybody. It's a wonderful day to be present on the World Day, and we all gathering to look at what agenda we can achieve this year. Last March, we all in a fuss and a confusion as to how to handle the situation. I'm sure the last 3 days have given us some time and really to understand how do we cope up with the situation. And interestingly, we all talking together to each other now is a blessing for all. Shubham karoti kalyanam arogya dhan sampada.
Yogi, shall we go with Dr. Mohanta's presentation in the meantime?
Yeah, sure, ma'am.
We'll just wait for Dr. Rajesh to log in. And also, whoever else is not talking, if we can please remain muted so that the recording quality is well maintained. Um, uh, Dr. Guru Prasad Mohanta is the vice chairperson of IPA CPD, and he's the former professor and head of pharmacy at Annamalai University. And as a leader who has been putting a lot of energy into the activities of CPD, I would invite Dr. Mohanta to please address us. Thank you, Dr. Mohanta, for being here.
Thank you, Sunita, for kind words. Honorable Vice Chancellor of Apex Professional University, Professor Rajesh Arora, respected resource persons, my colleagues at IPA-CPD, the colleagues at Apex Professional University, colleague at Pharmacon Society for Pharmacy Practice, and all those who are remotely taking part in today's webinar. My heartiest World Health Day greetings to every one of you. Friends, there are two vital sectors in any society. One is education, the other one is the healthcare. And today we see together people from education as well as the leaders of the healthcare profession. So a good beginning is made. Education builds the future of the nation, while the healthcare establishes a healthy nation. And I'm sure we are in the right path. This year, World Health Day calls for a year-long celebration to bring people together to build a fairer and healthier world. We made this beginning. Today, we have resource persons from different health professions. And the purpose is to provide the healthcare as a joint responsibility, not it is the responsibility of any individual or any individual profession. And this beginning, I hope, will go in long way and will have a sustaining effort to serve the society in a better way. Friends, health is perhaps the most important human resource. Without it, quality of life, whatever one situation may be, is diminished, and one's capacity to provide for oneself, for the family, and to contribute to making a better world is limited. Article 21 of Indian Constitution provides fundamental rights for its citizens. It ensures that no person shall be deprived of his life and right to live is a fundamental right. The Supreme Court of India has interpreted the right to health is an extension of right to life. Friends, it is only interpretation. And it is expected the country makes health as a fundamental right. A high-level group of experts constituted by the 15th Finance Commission has recommended that right to health may be declared as fundamental right in this 75th Independence Day of India, and it is expected a good decision from the government for this year Independence Day celebration. Friends, we are in the midst of COVID-19, and Corona has taught us many lessons from economies to the universal brotherhood. We need to protect ourselves from corona. There is no doubt about it. And at the same time, our neighbors should also be protected, because unless they are protected, we are not safe. So this is the hard way corona had sensitized on the need of universal health coverage. We want health for everybody. Friends, we have many pathies we have been talking of. We have been providing service through allopathy, through homeopathy, through naturopathy, and so on. But the patient needs only our sympathy, and that is possible if we care for the patient. I am sure all the health professionals, either doctors, pharmacists, nurses, and other health professionals, everybody will think of that. The caring the patient should be our priority. Thank you very much. Wishing you everybody a good session. Sunita?
Thank you, Dr. Manta. That was extremely comprehensive. Within 6 minutes, you brought in everything from the Constitution all the way up to the WHO theme, and really nice to hear all of it. Thank you so much. Much appreciated for that leadership.
Sorry, I have crossed 1 minute.
No, that's okay. We didn't count that. Right. So I think now we will continue with Mr. Tilak Gajendran's video. He's an entrepreneur pharmacist with rich background from 2 different countries, did a lot of work in, studied in Australia, and is now in charge of MedOx Pharmacy. So now we will request Alvin to please project his video. Thank you. We're not able to hear Alvin.
Good evening. This is Tilak Gajendran, founder of MedOx Pharmacy. Thank you for the opportunity given to me to talk about the role of pharmacists in preventing non-communicable diseases in this COVID pandemic time. So let's look at what are non-communicable diseases. As pharmacists, we are aware that most of them are like diabetes, hypertension, different forms of cancers, asthma, COPD. These are non-communicable diseases. Let's look at the stats of non-communicable diseases. So almost like 41 million people die every year. That's about 71% of the global deaths due to NCDs. And to be precise, each year about 15 million people die between the age of 30 and 69, and that accounts for more than 85% of deaths in low to middle income countries. So what are the issues that customers or even the patients have during these COVID times in managing the NCDs? Mainly, as you're aware, most of the hospitals, doctors' clinics are closed, or right now they're operating, but very minimum level of intakes of patients. So that really affects the way people manage the NCDs if they need any intervention. In India, what I can see right now is people are using platforms like DocPrime or Practo to get online consultations with doctors. And the other option we have is the pharmacist who's present in pharmacy, where the knowledgeable person who will be able to assist them with the NCDs. So, what are some of the potential areas where pharmacists can contribute substantially to combat NCDs? So, I've got 5 points involved in that. Number one being screening and monitoring the NCDs. So, in my own pharmacy here at Medox, we do have people coming up, or the customers coming up with. I have a lot of thirst. I frequently urinate, and I have issues with commonly getting impetigo or the stool sores, and even fungal infections. So we do test them for blood sugar levels, and quite often it happens that it's increased, and that's probably starting of the diabetic condition or the type 2 DM. And we also have people coming up with giddiness, and they say, please check our our BP, and we can often see people having high blood pressure during the checkup. During the testing. So that's the way we diagnose or screen the NCDs here, and of course, monitoring NCDs. People already having high BP, or they may have high blood sugar. They're on medications. We check them up whether they're on correct doses, or if there's any intervention required, and also tell them about lifestyle interventions. So next important thing is patient counseling on medication adherence. What we do is in Medox Pharmacy, like in international, what we follow in Australia or any other international Western countries, we do label the products. We tell them about how to use the product with their specific name on it, the doctor's name, and what are the common side effects, how to manage them if it happens. So we need to give them a tool which helps them to understand the medications well, like consumer medicine information, and even to the customers, patients, or the caregivers. Also we have to talk about the storage conditions they should use for storing the medications. So this is basically to encourage safe and appropriate use of medications to treat or prevent, manage the NCDs. The next important point is medication management review, which is quite important, which happens in a normal routine before the pandemic time. But even now, when we gather the records of the customers, it involves five components, which is basically the medication therapy review. That's where when we interview the customers, we ask them their understanding of the medications. Then we prepare a medication profile in using our software, and which is a personal medication record for them. And we also do a medication action plan if it's required, and if there's any intervention required, we do speak to their doctors and write a letter or even speak to them. And some of the doctors have really appreciated the way we do that, and they have informed their customers that they're really a very caring pharmacist. Next point being the public health and health promotion. So here basically we talk about more lifestyle interventions, like for example, in high blood pressure, we tell them not to have too much of salt, have regular exercises, at least 30 to 40 minutes walking every day. And with blood sugar levels, we tell them about the sugars which contain high carbs, and the food which contain high carbs, and also go for more millet food, and all sort of diet interventions as well. As a pharmacist, and also about their medication, when to take it, how to take it, what are the common side effects, and more diabetic education. We also have a smoking cessation program here, and I'd be happy to inform you that we have 2 customers who have left smoking now, and they're much more healthier now. So, and also with other things like breast cancer, we tell them about the female patients, how to examine the breast to look for any palpable lumps which are not painful, etc. So this is the way we prevent we do health promotions and improve the conditions, or request the customers to look for any issues that may exacerbate the NCDs. Last but not the least, so a pharmacist needs to have help the customers by giving them an improved access to medications and affordable medicines. So we store all generic medications as well as branded ones, so that they get the medications on time, and that's the way pharmacists can really be helpful in managing and preventing NCDs in the society during the COVID pandemic time. Thank you very much for the opportunity. I thank IPA, CPD, Pharmacon Society, and Apex University for giving me this opportunity. I hope it was a learning curve for everyone, and it was helpful for them. And thanks again. Have a good day. Bye bye. Good evening.
Thank you. Thanks, Mr. Tilak, for putting the focus on what is happening in India, especially with the NCDs, and where during COVID, the access to healthcare has started decreasing. It really makes sense to start talking more about community participation, start talking about prevention, and having a better understanding of what are the four drivers that are pushing the NCDs in India, because it's a epidemic increase. So it's the low and middle income countries where we see 75% of the mortality as well as the issues coming up. So if we can use different situations, especially the World Health Day, to promote the four key factors, to promote the understanding of the four key factors which are pushing the epidemic, which is definitely food high in salt, fat, and sugar, which is definitely the physical inactivity that is increasing for all of us, and tobacco and alcohol. So, if the awareness is surrounding these four issues, then we could definitely be looking at a much healthier society, because what is going wrong now is the productive age group population is the one that is succumbing to the NCDs, whereas initially we used to always see the older generation succumbing to it. So we need to really change the way this is happening, and it definitely starts with preventive actions, more of screening that takes place, and a lot of monitoring that needs to happen, so that we are not looking at the complications of these uncontrolled conditions taking us down the wrong path, because health and development are intricately linked, and we really need to focus on NCD. So thank you, Mr. Tilak, for all the information that you gave us. Next, we'll have Dr. Anita Sagarkar. She's an associate professor. She's in the Department of Public Health Dentistry in the Faculty of Dental Sciences, and she's based in Ramaya University in Bangalore. So Dr. Anita will be talking to us more about the oral health aspects. Over to you, Dr. Anita, and thank you for making time for us. Dr. Anita, while the slides come up, I think you can just initiate the conversation.
Yes, ma'am, I'll do that.
Sure, thanks.
Good evening,
Yeah.
everyone. First of all, thank you for this opportunity given. So it is really indeed good to be on this platform with all of you. So now is that the slides have started, I hope you're able to hear the voiceover.
I'm not able to hear yet.
If you can please reshare it. Do you want me to share the screen?
Anita ma'am, should I share the screen or else?
Yeah, you can share the screen. It will automatically
fine.
play.
Alvin, you can just stop it. I'll just do it. Yes, ma'am, I'll be presenting it in a second.
Good evening, everyone. This is Dr. Anita R. Sagarkar from Ramaya University. I'm here to talk about oral health literacy. Thank you, dear organizers, for giving me this opportunity. This is the overview of my presentation. I'll be presenting a small story, and we'll all understand. Let's all understand why oral health literacy is important, and what we can do as a people from different disciplines. In 2013, my cousin sister Rashmi, calls me up and she says that, she has gingival bleeding. I very ignorantly say, hey, you must not be brushing properly. Why don't you brush twice a day? And I cut the call very ignorantly. And only a few days back, we get to know that she was suffering from dengue shock syndrome. And the reason for her gingival bleeding was inappropriate number of platelet numbers. And unfortunately, we lost her because of that. I will not place the blame on me, but the healthcare professional who met her did not identify that the gingival bleeding can also be a finding in identifying dengue shock syndrome. So let us see what is the definition of oral health literacy now, which is what is the main show point. Oral health literacy is the degree to which individuals have the capacity to obtain, get that information, process it within themselves, and comprehend, and so that this information is very essential for them to utilize the oral health care services. Important, and above all, they should put all these information and they should be able to take a informed health decision so that they have a optimal oral health. This is the beautiful definition given by Healthy People 2010. Why is oral health literacy important? This is a beautiful systematic review from Firmino 2018 that shows that, oral health literacy has the level of information or the level of knowledge an individual has about oral health related information. It has a direct impact on him, and it influences how well a person utilizes the healthcare services, how he defines or decides to suffer with the disease per se. If at all he is aware about the disease, if he is well clear about what a disease looks like right in the beginning, there are chances that he will not suffer with that disease. He will present early to the healthcare system so that he can be treated well. The severity of oral health related issues, they found that, were less with the people who had a better oral health literacy. Overall, we all, dream for it, a better quality of life. That is what is the impact of, knowing information, a lot of information about oral health. And I have not stated one key point here is that oral health literacy has an impact. Oral health literacy and health literacy both are interlinked. It's like I'll state one example here, one beautiful example, how oral health can be as a basement of behavior to your general health. First thing when we wake up, we brush our teeth. It's just a matter of 1 to 2 minutes. We will just think like that. But if at all we set a stage by, being adherent to brushing teeth twice a day, especially early in the morning, as an act of behavioral key component, that will get carried over to other aspects in our daily life. There are more chances that we will exercise. There are more chances that we will go up and take up other simple challenges and will solve it to the best of our knowledge. So these are the carryover effect or the chaining effect it will have on other health related habits. This is how I relate to oral health. So knowing this solution, where does the problem or where is the challenge that we face, that lies? We have to address the mismatch between the demands of the oral healthcare system and the skills of using it, working with the system. So the skill sets of the professional who belong to dentistry also must be empowered, and along with that, those who belong to other professions like nursing, medical, pharmacy, physiotherapy, etc., they also need to be empowered, as in how oral health can be, improved. So, armed with this basic information or evidence or data related to oral health literacy, so we need to develop, implement, and evaluate different different interventions for a specific target groups that we come up, which should be more integrated. We need to educate policymakers, as in how to prevent oral health related issues, which need not be done separately, which can be clubbed with other issues that are close by. And how do we implement policies that foster the improvement of oral health literacy? So, at the bottom line, I would like to end this presentation by telling oral health literacy is inextricably linked to improving overall general health, especially among the low income groups. Each of us has a role, opportunity, and responsibility to improve oral health as interdisciplinary personnel.
Thank you, Dr. Anita. That was a very comprehensive presentation. If there are any questions, we would have space for one question. And if we don't have anyone asking you questions, we are definitely happy for you to add any other thing that you thought is important. But what I would really like to add from my side is, as much as we tried our best to have this as an interdisciplinary space, thank you for bringing in that concept from your side as well, where you see space for all healthcare professionals to be working towards a common goal, rather than saying that oral health literacy is just meant for those of you who work in the public health dentistry. So thank you for making it inclusive, because the whole idea of moving forward is to work as a synergistic teamwork. So thank you for bringing in that. So that I thought was really, absolutely spot on with your presentation. So
thank you, ma'am. I would like to add one very important information, or rather takeaway message for all of us. I would like to emphasize that we all have silo roles that we are happy playing it with our own strengths. But imagine what if we all complement our strengths and we are so empowered that I don't feel a day comes when I don't feel very uncomfortable identifying some kind of a medication error with somebody, or somebody else from pharmacy is able to identify some oral health related issues where there is a repetitive antibiotic prescription that is happening very irrelevantly. So that kind of cross identification, probably oral health literacy is something which acts as a strong basement. We all need it. Oral health literacy, first of all, we need to be empowered, and at the same time empower our sister institutions. Usually what happens is medical, dental, and engineering, all the specialties, they all lie within the campus or within a few kilometers and everywhere. If you look at all the places, especially in the international platform, I believe this is a mandate. And once this happens, we will not have that age-old fear of, dentistry means just extraction of teeth. It's something beyond. We have moved on. We're abreast with the technological advancement that has happened. And we are very far beyond anybody's imagination. We have become very simplistic, more patient-friendly, and more preventive and promotive oriented. So I would like to close this lecture with that very clear note to everyone. And I wholeheartedly invite everyone to feel free and get empowered about dentistry and see the beautiful smile with your, family members and friends. Thank you.
Yeah, thank you so much, Dr. Anita. That was really wonderful. And we really look forward to creating those spaces, because, for example, the IPA CPD is also having a multidisciplinary advisory group in which you will also be playing a major role. So that crossover needs to happen and the cross-pollination needs to happen. So at the end of the day, the common goal is population health. And the common goal is that individual patient's health. So while we are looking at that entire spectrum from patient health to the population health, it just brings everybody's strengths into one place, because this is not about any kind of a competition or feeling less or more in the hierarchy. I think this will be a good way to break the rigid hierarchies, only to make space for the commonness of the intentions there. Thank you so much. Much appreciated for investing your time into this program of ours. Thanks a lot. So the next presentation that we will have is again a video from Dr. Srikanth Konda, who is a medical doctor by training and then has enhanced that with his MPH. And he is the principal advisor in the Ministry of Health in New Zealand. So what is, before the video starts, while I give time for the video to start, what is also nice with the kind of program we are having today is to look at how we can make things a little asynchronous, where we don't need every presenter to be online, because we are now bringing in people from an international space. We're bringing in people like Dr. Mallikarjunaya, who is traveling at the moment, but still is online, but can't give a talk and things like that. So COVID has taught us many things if we are ready to learn. And I think what we are doing at IPA-CPD is bringing these video recordings, as well as those who are able to join us online, and having a mix of the two. So we experiment with how we can learn and share with this kind of a thing better. So now we are going on with Dr. Srikanth's presentation. Thank you.
Kia ora, everybody. As we say in New Zealand Maori language, it means hello or welcome. I'm Dr. Srikanth Konda, a medical doctor who studied in India and did my post-graduation in public health in New Zealand. And I worked all over the health sector in New Zealand, and I'm currently working as principal advisor at Ministry of Health, New Zealand. Today, my talk is New Zealand take on COVID pandemic in public health leadership and policy perspective. So my recorded talk today is based on the leadership approach and practices of New Zealand government led by our Prime Minister and the Director General of Health at Ministry of Health in response thus far to the COVID-19 pandemic. It shows how a shared sense of purpose has been established, that of minimizing harm to lives and livelihoods of people, for which the government has sought and secured New Zealanders' commitment. Key leadership practices comprise the government's willingness to themselves be led by expertise, its effort to mobilize the population and to enable coping, all of which serve to build the trust in leadership needed for transformative and collective action, such as the pandemic demands. New Zealand's government response to managing public health aspects of COVID-19 has moved through a series of phases, although adopting a precautionary approach that is informed by the best available science and health advice has been consistently emphasized. Our PM has announced a 4-level alert system, which sets out what response measures apply depending on the extent of the virus's presence in New Zealand. I would briefly explain the alert levels. So alert level 1 is about prepare. To prepare pertains to when COVID-19 is contained domestically but is uncontrolled elsewhere. We are currently at alert level 1 until the COVID-19 pandemic has been eliminated completely. So New Zealand has been in alert level 1 for quite a long time. Alert level 2 is reduce, which means while COVID-19 is contained in New Zealand, the risk of community transmission still exists. And alert level 3 is restrict, means there is high risk of the disease is not contained domestically. And alert level 4 is lockdown, which means it is likely the disease is not contained domestically. Watching all this from my home in New Zealand, where I live actually, Wellington, capital city of New Zealand, where respect for science, facts, and evidence were calm but potent efforts to mobilize collective adherence to safety measures and were a suite of efforts to aid in coping with the efforts of the pandemic have all been such prominent aspects of our government's response. The gap between the good and bad leadership is something I experienced viscerally when compared to the rest of the world. So having explained the overall approach taken by the New Zealand government, does leadership matters? Yes, it does. And leadership principles applied in New Zealand are of world-renowned standards. So the leadership framework we followed in New Zealand is to foster a shared purpose, minimize risk or harm to lives and livelihood. So we followed 3 key leadership practices: be led by expertise, which involves following the science and evidence-based research and use facts and evidence-based research in dealing with the pandemic. Listen to the advice from relevant experts, which our government has done quite brilliantly. And mobilize collective effort, which is the second we did, which is to inform and educate people and not actually put people under pressure or convey the direction and meaning. Empathy and showing empathy are the key principles in mobilizing collective effort. Unite people against COVID in fighting COVID, and address the practicalities in following the and risks in following the things to prevent COVID-19 spread, and avoid defensiveness. The first thing our government and ministry did was actually to take responsibility and avoid any defensiveness in dealing with the situation. And finally, solicit feedback, accept feedback from all the people, and change things according to people actually, and people-centered approach. And the final key leadership practice we followed is enable coping. To enable coping, we need to enable planning. So we had a proper plan to deal with different things at different levels of alerts. Build relevant knowledge and skills in relation to how we're going to deal with the situation. So, and enable sense making in terms of how we're going to manage the COVID-19 situations during lockdowns or at different alert levels. Enable kindness is very important, and which is followed by all the people. We were kind to the business owners who closed the businesses. We were kind to people on daily basis, and kindness was the main thing which was practiced and also advertised mostly on the television and the radio and elsewhere in the media here. And finally, develop creative responses. Our ministry has done quite a lot of television ads and radio ads, which are quite creative, which targeted different kinds of people and different groups of people, like teenagers and people, young people in music concerts. There was a video actually from our Director General, which was actually remixed into a theme of music, and people listen to it carefully as they listen to their favorite bands. All these measures and practices have actually finally led to build a trust in our leadership. So having explained the overall approach taken by our government, New Zealand government, does leadership really matters? Yes, leadership matters in actually dealing with potentially life-threatening consequences of COVID. So the potential life-altering consequences of good or poor leadership have, for many of us, likely never been quite so starkly apparent than at present. Evidence grows on a daily basis that the acts or omissions of some political or business leaders have contributed to the virus spread, resulting in mass fatalities, which could have been avoided had these leaders followed the advice of experts and health professionals. So finally, thank you for giving me this opportunity, and I wish you a happy World Health Day to everybody. And I thank the organizers of this conference or meeting and giving me this opportunity to talk to you all. I'm happy to give further talks on these, on any topic related to public health leadership in the future, and most welcome to ask, post any questions and ask me in the future. If you want to contact me, you can add me on LinkedIn as well. Thank you so much.
Thanks a lot, Dr. Srikanth. I think this crystallized message could not have come to us at a better time, because as India is going through its second wave, as we have crossed the 1 lakh per day, fresh cases, I think where we also need to start looking is, like Maharashtra is talking about how there is an increase of cluster infections. And if we don't put enough efforts on our infodemic related issues, and if we don't take sufficient responsibility, I think we are really not going down the right road in this case, because we are not looking at whose life for whom. If our essential service providers and our healthcare professionals and our healthcare system is taking the biggest responsibility in all of this, only because we want to normalize life very quickly and we find it difficult to wear the mask above the nose, I think it is completely uncalled for, because we in a democracy may have all the rights to make decisions for oneself. But if those decisions in a pandemic is affecting our healthcare professionals, our healthcare systems, and our essential service providers, I think that is completely uncalled for. So leadership that Dr. Srikanth explained is absolutely a big aspect. But I think it is also about leadership that we take cognizance of within ourselves and within our communities and as community members. A part of this is also about the civic responsibility and the leadership that needs to be taken in those places, because this is not the time to be led. It is time to take leadership for one's individual actions, because it has consequences on the society in general. So thank you, Dr. Srikanth, for making time and sending us this video. So having kind of summarized that aspect and looking at the concept of building a fairer and healthier society for everyone, I think now we will be moving on, and now we will have the next person in our interdisciplinary team, which is Professor Devi Nanjappan. She is the principal in Nagaratnama College of Nursing, Bengaluru, which is a part of the Acharya institutions. And we will be playing her video next. Thanks, Alvin and Yogi.
Good evening, everyone. This is Devi Nanjappan, Principal College of Nursing, Acharya Institute, Bangalore. At the outset, I thank Dr. Sunita having given me an opportunity to speak on global health and nurses' role for the same. And I take this opportunity once again to welcome our audience for this webinar, which is organized today, World Health Day, with a theme relation called Build a Fairer, Healthier World to Everyone. And nurse has a very long history of service to the global community, and we may wonder what is the new things we need to do now. So very simple, that we need to keep up a mantra called map the global health with the expanded nurses role. Okay, there are few expanded nurses role need to be emphasized in order to maintain the population health outcomes. So what are those? Number one, the nurse need to understand that there are the catalysts. They are going to make a change in the health outcome of our populations. So they have to see what changes happening in the emerging health issues and what is globalizations. How are you going to control this globalization? What globalization makes impact on the population health? Okay, when you understand these questions, or when you ask yourself, and then probably this will take up to the next level, like probably this globalization globalizations need to be included in the curriculum. So that the curriculum has to say that what are the recent globalization impact the population health and what are the nurses' role. In that way, you all has to come out and be a changing agent and then be a change role model and then bring the new syllabus in which the new youngsters, when they come up, they will understand what are the globalization and then what they have to give back to the society. That's a number one as an expanded role. And as usual, the second is that you need to be advocator. What is advocator here? As a nurse leader or a young but of nurses, whoever in the system, they have to involve in the policy making. In here, we have to talk about the health policy making. So we have to strongly recommend what is required for the health issues control. Okay, all has to sit and then recommend one common standard operating procedures to prevent and control the emerging health issues. Let's say that you just keep aside the pandemic. There are even the other issues in strong now. It's coming up. Is called non-communicable diseases. So lots of activities is taken up by the government sectors and even at the private sectors. There are wonderful strategies being taken up to control those things. So I advise here that all the nurses has to come once again volunteer in order to prevent this non-communicable diseases at the very primary healthcare setup itself. Like we need to take up a lot of projects in the community area, like and throw the knowledge of how to control and prevent the non-communicable diseases. In that way, we can be advocator. And thirdly, we need to talk about the artist, nurse as an artist. What is an artist here? It's very simple. We need to be very competent in giving a nursing skill to the population. So whether you work in the long-term care or work as an ambulatory nurse or you work as a tertiary care nurse or you go as the mobile health nurse, now the new concept come as a tele-nurse. So whatever the role you take up and make sure that are we competent ourselves to give 100% quality care to the population. So when we do our role perfectly, and probably it will always impact the positive outcome amongst the global population. And then you need to think that are we the acting. So the like nurse as an activist means that you never give up. So any situations in any phenomena or any field you take up, there is a corruption, there is a compromise in the resource allocation. So let's not give up. So we need to actively participate in providing a quality health care to the population. So that's at one point of time probably that will afflict the global health at the international level across the planet. So our role is very important. So never give up. So be a very active person in controlling and preventing the global health issues. And finally, we need to think of, are we doing or involving any scholarly activities? So if you look at entire nursing fraternity, and be very rare people will involve in the nursing research. So I earnestly request everybody, including me, we all of us to come forward and take up the active research in bringing out some positive evidence in order to control these the global health issues, and thereby you can say a beautiful healthy country. When we always say that health is wealth, so we have to invest a lot of time in doing the scholarly activity, and definitely this is going to impact the health outcomes of the global populations. And finally, we are the citizens. So how we responsible for others, the same way you are responsible for yourself. Be a responsible citizen, be a responsible nurse, and ask yourself that am I giving a equity care to all the people? Whether am I accessible to all the cases given by the government? The same way you need to question yourself that all other people in the sectors getting the equity and access care, because these two terms is often not fulfilled. Like the access and equity is always questionable. So our motto is going to be that we need to be strongly give equity care, and all the people in all other every level has to get the access care. So this is a final responsibility of us being a citizen. We need to ask ourselves. And finally, please expand your role apart from the tertiary care. Work as a nurse researcher, work as a clinical healthcare provider in different and variety of health settings, probably. So that would help us to understand what we are doing and what is that our contribution towards the maintaining of global health. Thank you so much for this active listening. So by conclusion, I would like to say that maybe a small drop of water will become a big ocean. So we nurses has to come together and be as an empowered community in order to deliver quality care. So thank you so much for this opportunity. And thank you once again the organizers for giving me an opportunity to speak on this wonderful day. Thank you.
That was excellent. So it was really nice to see Professor Devi talk about things as important as, each person brings their one drop to make the mighty ocean. So the mighty ocean is only a culmination of several of those drops. And what was really nice from that talk is about not giving up. That was, I think, the other take-home message. Just because we are going through a pandemic, it doesn't mean we ignore what needs to happen in the non-communicable diseases, which is also what Mr. Tilak spoke about at the beginning as well. So the synergy that we seem to be drawing from different healthcare professionals, from different walks of life, is all kind of going to the same point, because where we are heading is we can't just be focused on the curative side of the biomedical model. We can't say that if there is a disease and we have the medicines, we are sorted. So we are now looking at how different healthcare professionals are bringing in the prevention aspects. They're bringing in the curative, of course, has always been the central part of our biomedical care, the rehabilitation aspects. But what is also coming through quite clearly in all of this is we are also seeing the civic responsibility coming through from different people, from whether it is a policy and the leadership that Dr. Srikanth was talking about, or whether from a nursing perspective, Professor Devi was talking about. So it's very heartening to see that we are all thinking in similar ways. And, the World Health Day seems to be really a common platform for bringing in all of that. So that was really good. And thanks, Professor Devi. I think now we're going to the last video, and this will be from Dr. Mallikarjunaya. He's a professor and he's a principal at Acharya's NR Institute of Physiotherapy in Bengaluru. And over to Dr. Mallikarjunaya's presentation, please. Thanks, Alvin and Yogi.
Hello everyone, I am Dr. Mallikarjun, Principal, Acharya's NR Institute of Physiotherapy. At this moment, I would like to thank Indian Pharmaceutical Association, Community Pharmacy Division, and Pharmacon Society in association with Apex Professional University. And at this moment, I also like to thank Professor Sunita Madam, who gave me an opportunity to talk on World Health Day. Before me starting the talk on World Health Day, let me wish everyone a happy World Health Day. As we say that there is a need for like that, I would say that there is a need of a day during this pandemic. Everyone celebrate this World Health Day by arranging the talk and bringing the awareness. But everyone should know why we celebrate this World Health Day. This World Health Day we celebrate to bring the awareness of the global health, to prevent, to protect, to motivate for the better health. As a physiotherapist, I have taken a topic called as Fit, Fairer and Healthier Life for this 2021. You all know that what happened in 2020 due to pandemic, but now we are in 2021, no difference at all. When we have less number of cases, we were inside, now there are more number of cases, we are outside. So it gives very importance to this World Health Day. So at this perspective, as a physiotherapist, I would say that exercise plays a very important role. I chose a topic called as FIT, F-I-T. So I would like to add F-I-T-T as a major principle, what we call it as FIT principle, F-I-T-T. What is F-I-T-T? F for frequency, I for intensity, and T for time, and the last T is for the type. So why this FIT is more important? We all know that every one of us, we do exercise. Some of you go to the gym, some of you will do yoga, and some of you simply go out and walk, or you will walk outside your house or inside your house, And some patients, they tell me that they work a lot as a housewife in the home and they do exercise as a part of their routine. But when you do an exercise, the most important thing which you are supposed to consider is the FIT principle. First one is frequency. How many times you do that exercise? So you can ask me, sir, how many times you want me to do the exercise? The answer is it depends upon individuals. If it depends upon factors like what is your BMI, what is your gender, you have any comorbidities, why you want to do that exercise. So frequency is the most important, that how many times you do exercise. That is all about frequency. Next one is the intensity. How much intensity you do that exercise. You do that exercise till you sweat, till you feel that okay, I have reached the maximum heart rate. I'll give a small formula where it has been designed. At this moment I can tell, that is the target heart rate. So we talk about target heart rate, that is THR. How to define your heart rate for the exercise? That is THR, target heart rate. How do you calculate? For example, your age is 20. So the target heart rate is 220 minus age. So let us calculate 220 minus 20, that is 200. So your target heart rate should not cross 200. Although this is a clinically established and more reliable formula to understand the intensity of the exercise, but nevertheless don't try to reach to a maximum heart rate. Try to reach within that. Maybe we call it a standard deviation of 10 to 8, more or less. Definitely it should be less. That's about intensity. Next one is the time. How long you do exercise. That's the most important. People say that I do some of the exercise like this and all. So how often you will do, how long you will do. That's the most important thing. Everybody has to be defined. Who will define? Your trainer will define. Even a physiotherapist can define how long you can do that exercise. And the last one is the type of exercise. In type of exercise, we always say that there are two types of exercise or the fitness level, what we call it as cardiopulmonary or cardiorespiratory fitness, and the second one is musculoskeletal fitness. So there are two types, cardiorespiratory and musculoskeletal. If I want to put it in other word, it can be aerobic exercise and anaerobic exercise. So you all know that, as the word itself says that aerobic, which is done in presence of air, means it will increase the capacity of the lung, that is your tidal volume and everything, which is the more physiological properties of the lung. And the next one is the fitness, what we call it as musculoskeletal, that is the individual muscles. So I would call it as anaerobic exercise. So here aerobic and anaerobic. Aerobic exercise, it is a resistance exercise which is done directly to the limb. I was given to talk about 6 minutes, but I would say that if I talk on fitness and as a physiotherapist perspective, I may require more than 60 hours to talk on that. Nevertheless, at this point of time, I would say that all of you be fit. The fitness can bring a lot of changes. What are those changes? It will change the complexion of a person. Means you become fairer. People go for artificial makeup and lot of surgeries. But you do exercise, you become fairer because of the toxins which comes out as sweat glands are stimulated. So most important thing, the more the exercise, the better your musculoskeletal system, better your cardiorespiratory system. At this moment, at this particular time during the COVID, I would say that try to give the health to others. Means if you want to gift somebody elderly a gift for their birthday, kindly choose any of the diagnostic tests from any of the diagnostic center and say that you go and do ECG, you go and do echo, you go and do these kind of blood investigations. That will give better results and they can be diagnosed and they can be worked for their betterment. So at this moment, I wish everyone again a World Health Day. Thank you.
That was absolutely spot on from Dr. Mallikarjunaiah. And I think the key messages of being fit and what was really wonderful is the wonderful interpretation of a fairer, healthier society in its not a figurative way, but in its literal way. And in a country that is so obsessed with being fair, I think there's nothing more important than saying that if you exercise more, you'll be more fair. So I think now we will have more people who will think of being physically fit, because at the end of the day, health is not about absence of disease. Health is more than that. And health is when there is fitness, not just in the body but also in the mind. So the physical fitness goes beyond beyond just being, looking at the cardio or the musculoskeletal systems. It is also about the emotional health, especially during times of COVID, where it is more of becoming alone, but also experiencing the sense of loneliness, which is kind of getting to all of us in different ways. This is a wonderful message. So thank you, Dr. Mallikarjunaya. Now we go to our last speaker who's coming live. This is Dr. Anuradha. She's the professor and head in the Department of Pharmacology at MS Ramaiah Medical College in Bangalore. So Dr. Anuradha, thank you very much for having had all the patience to sit through all the presentations, because now you have this no pressure but wonderful space to kind of bring it all together for us so that the take-home message is really strong from your side. Over to you, Dr. Anuradha, and thanks for being here.
Thank you, Dr. Sunita. Am I audible?
Yes, absolutely. Please go ahead.
Okay. I thank the organizers, Indian Pharmaceutical Association, Community Pharmacy Division, Pharmacon Society from Pharmacy Practice, Apex Professional University, and of course, Dr. Sunita for giving me an opportunity to share my views on vaccines for a healthier world today on World Health Day. I'll be not speaking much about the COVID vaccine today, because as you know, like it has made a lot of buzz in the social media. I'll be speaking vaccine in general. What is vaccine? Vaccine is defined as a biological preparation that provides active acquired immunity to a particular infectious disease as per the WHO. As we all aware, each year vaccines prevent more than 2.5 million child deaths globally. An additional 2 million child deaths could be prevented each year through immunization with currently available vaccines. Why do we need vaccines? There are a lot of reasons for it. First and foremost being, vaccine promote health. By helping the healthy people to stay healthy and in turn promote healthier world, removing a major obstacle to human development. Basically, it works by reducing the risk of getting a disease by working with your body's natural defenses to build protection. When you get a vaccine, your immune system responds. Second reason being, vaccines have an expansive reach. As they protect individuals, communities, and entire populations, the best example would be the eradication disease like smallpox by vaccinating to the mass. Third, the vaccines have rapid impact. The impact of most vaccines on communities and populations is almost immediate. For example, between 2000 and 2008, vaccination reduced global deaths from measles by about 78%, from 750,000 deaths to 164,000 deaths per year. Vaccines also saves lives and costs. Recently, a panel of distinguished economists put expanded immunization coverage for children in 4th place on a list of 30 cost-effective ways of advancing global welfare. Last but not the least, to combat pandemics like the current situation, COVID-19. What are the types of vaccines available? There are 4 types of vaccines available. Live attenuated, classic example would be the BCG. Killed ones, the pertussis vaccine. Subunit or purified antigen, that is hepatitis B. Toxoids, that is inactivated toxins, that is tetanus toxoid or diphtheria. When do we need to take vaccines? Vaccines to be taken at right time, that means at the right age, to prevent various diseases like tuberculosis, hepatitis, polio, tetanus, and many more. As per the immunization program, the following vaccines are recommended for children, that is BCG vaccine, hepatitis vaccine, polio vaccine, oral and injectable ones, DPT vaccine, MMR, rotavirus vaccine, pneumococcal vaccines, typhoid, and vitamin A. For the adults, vaccines which are recommended which are not mandatory but recommended ones are influenza vaccines, tetanus, diphtheria, pertussis, varicella, and MMR. For the adults up to 45 years of age, human papilloma virus vaccines is recommended. For adults 50 and older, shingles vaccine. For the geriatric population, that is 65 and older, pneumococcal vaccines to prevent the repeated respiratory tract infections. And for the current situations, for all the healthcare professionals who are considered as the COVID warriors and also the frontline workers, COVID vaccine. And right now, the government of India has recommended for the 45 years and above for the general population the COVID vaccine. Vaccines which are under clinical trial are malaria vaccine, dengue vaccine, and chikungunya vaccines. What are the safety concerns of vaccines? Are these vaccines are safe? Vaccines used in the national immunization programs are considered to be safe and effective. However, like other pharmaceutical products, vaccines are not completely risk-free, and adverse events will occasionally result from vaccination. Although most adverse events are minor, for example, like the redness at the injection site, pain at the injection site, fever, malaise, sometimes even the GI symptoms like diarrhea, and some could be the serious reactions like seizures and anaphylaxis, which occurs at very low frequency. Hence, a higher standard of safety is always expected of immunizations compared to the other medications that are used to treat the various other illnesses. Always the safety is of the priority when it compared to the effectiveness when it is considered for vaccine. To conclude, immunization currently prevents 2 to 3 million deaths every year from diseases like diphtheria, tetanus, pertussis, influenza, and measles. Despite tremendous progress, too many people around the world, including nearly 20 million infants each year, have insufficient access to vaccines. We mean to say, like, still there are much population needs to be covered in order to make the disease free. This lower tolerance for risk from vaccine translates into a greater need to detect and investigate any adverse effect following vaccination than is generally expected for any other pharmaceutical products. Millions of people are at risk of diseases like malaria, Ebola, HIV, and Zika, for which vaccines are currently in development, mainly to prevent the morbidity and the high mortality. Vaccine to be administered at the right time and should be administered for the appropriate age at the right age for creating a better, safe, and healthier world. I just want to stress upon, like, get vaccinated for COVID-19, follow the social norms, and stay safe. And happy World Health Day to all. Thank you.
Thanks a lot, Dr. Anuradha. That was extremely comprehensive. And I think it was wonderful to end it on the prevention-based note, because we also started with Mr. Tilak, who was talking about NCDs and where we are heading. And then it was really good to have the last session on vaccines and the prevention. Nothing better to ask than moving away from the biomedical model. Dr. Kiran, if you could please mute yourself so that we don't hear it in the recording until you're ready to talk. Sorry about that. So what would be really nice is to our take-home message is about prevention, which really becomes the crux of everything, whether we are looking at COVID or whether we're looking at vaccine being a key tool for our public health issues. So prevention becomes the central point. So as much as prevention is the central point, curative aspects, rehabilitative aspects have always been the central point. So they take their rightful places. And I think it is a really nice way to end the World Health Day with this very comprehensive, multidisciplinary space. What I would also like to point out is this was not at all by design, but it also turned out that we had equal representation by women here, women health professionals. And it is extremely important to point that out because India has fallen 28 places on the gender gap report. We are not in the top 10 countries, but we're in the bottom 10 countries. We fell by 28 points compared to just 1 year. So if it is COVID related, I don't know. We need to look at more of that report. But irrespective of where we are heading as a nation, I think I can take absolute pride here as a woman professional that if we are 50% of the population, it is extremely important to have women professionals well represented in any forum we are talking about. So this was also a wonderful space to bring in women professionals to add their strong voices to what we have going on, because at the end of the day, this is not a competition, it is a collaboration. It's about working together as an additional thing. So now we have Dr. Kiran, who is representing the Apex Professional University, who will give the vote of thanks and who will end the session today. Thank you, Dr. Kiran. Thanks very much for taking on with the vote of thanks.
Thank you, ma'am. Please confirm, am I audible to you?
Yes, Dr. Kiran, you're absolutely audible. Please go ahead. Thank you.
Ma'am. Thank you very much. I, Dr. Vema Kiran from Apex Professional University, feel immensely privileged to present my vote of thanks for this webinar. I thank our Honorable Vice Chancellor, Professor Dr. Rajesh Arora, for his constant encouragement. I thank Dr. Guru Prasad Mohanta, who is the Vice President IPS CPD, to join us for this event and to give a devotional touch to this webinar. I thank Mr. Tilak Rajendran, entrepreneur pharmacist, for enlightening us about the pharmacist's role in managing non-communicable diseases. I thank Dr. Anuradha, Professor and Head of the Department of Pharmacology, MS Ramaya Medical College, for explaining about the importance of vaccines for the healthier world. This is need of the point. Thank you, ma'am. I thank Dr. Srikanth Konda, Principal Advisor, Minister of Health, New Zealand, to enlighten us about the role of policymakers, especially during this pandemic situation, towards population health. Thank you, sir. I thank Dr. Anita Sagarkar, Associate Professor, Department of Dental Sciences, Ramaya University, for throwing light on need of oral health literacy for good health. I thank Dr. Mallikarjun, Professor or Principal, Acharya NR Institute of Physiotherapy, for educating us about physiotherapy perspectives for good health. We will follow your idea of giving gifts, sir. Thank you, sir. I thank Professor Devi Nanjappan, Principal, Srimati Nagaratnama College of Nursing, for making us understand the efforts of nurses and the related professions in making society healthier. At this point, I take the opportunity to thank Dr. Sunita Chandrasekhar Srinivas and her technical team for putting their efforts and for the timely efforts to make the webinar successful. I thank our head IT, Sandeep Sharma of APU, for his support during this event. I thank all others who directly and indirectly helped us to make this webinar successful. Thank you all, thank you, and I. Thank you, ma'am.
Yogi